Hey, I'm Mike Gilliam, and we are not coming to you this time from the CUNY TV studios in Manhattan. The building, like much of New York, has been shut down. We're coming to you from ground zero in the fight against coronavirus, New York, but from my home. Welcome to Let It Rip. Our building is shut down because of the virus. Now, these are difficult times for all of us. Life has changed drastically out there. People are out of work. Businesses are closed. More importantly, people are dying. Others are sick or will get sick, and thousands have been hospitalized. And I think that really, when you think about it, that's a good place for us to start our conversation. Joyce Brayboy was recently released from the hospital. She has COVID-19, and now she's under quarantine in her home. Joyce, we're glad to hear that you're doing better, and thank you for talking to us. Tell us about your experience with coronavirus.
I was feeling like I was coming down with a cold and I'm not really sure what a cold symptom feels like because I haven't had a cold in years. So I felt like I was like coughing I actually was coughing, but nothing really was coming up,
Is that that dry cough that they've been talking about?
Yes, I had a very heavy, and I was coughing so much that my rib cage was aching, and I would go into like bouts of coughing where I couldn't stop coughing for like sometimes maybe 2-3 minutes.
Is that when you knew that something was wrong, that this was more than just a mild cold?
Yes, because I don't even get a mild cold, so I actually didn't realize what was going on at the beginning, but I knew that I was feeling tired. I had no appetite at all.
How do you think you contracted the disease? Do you think that you came in contact with somebody who had been abroad, or what do you think?
Well, I'm not around a lot of people who go out of the country but I'm just a regular mother and grandmother who really stay around in the community. Furthest I've traveled in the past couple of weeks was to Albany, New York. And that was within that time period. I was going back and forth on Amtrak and to see my newborn grandson in Hudson, and then,
Okay, so you had been moving about a bit, and you had been on some
moving about on the train more than normal.
Okay, so once you had these symptoms, a bad cough, and you realized that something was wrong, what happened next?
Went to the hospital on that Friday night, which was the 13th.
Okay.
And they tested me. They took my blood pressure, and I had a fever. I was coughing, and they said, okay, we're gonna have to take you in the back. You have to be isolated from the population. And they took me into the hospital.
This must have been very frightening.
Yes, it was, because I was isolated in a room alone. And then they came in. They said, "Are you having problems breathing?" I said, "No." But they actually put a oxygen mask, and they said, "We're gonna, put the oxygen mask on you, and we're gonna monitor you. And you have a nurse assigned to you, and that's who's gonna come in." And they were dressed. These people in the hospital, anybody who came to see me, they had their head covered, their hands on gloves, they were properly dressed.
What were you thinking? What was going through your mind while all of this was happening?
Well, I wasn't thinking that I had a coronavirus. I just thought I had bad flu or something, a cold or whatever. So in my head, I was not trying to feel like I'm getting corona. No.
So Joyce, you're at home now and recovering. What is the treatment? Did they give you medicine?
They didn't give me any medicine to go home with. They gave me my last dose of hydroxyquinine and several different antibiotics while I was in the hospital, but nothing to go home with. Prescribed in the hospital was zinc and 1,000 milligrams of vitamin C.
How about the pain now? Is all the pain gone?
It's the coughing. Just the coughing is the main symptoms that I have from it. But they did a chest x-ray and they said that the pneumonia that set in from the virus is going away. So
What would you say to those who are still kind of saying, it's not going to affect me? You know, this coronavirus thing is kind of hyped up.
no, it's not hyped up. I think that everyone should be worried about catching it. I'm a normal, regular person and I got it. I'm just worried about being catching it again because they're still not telling me that I can't catch it again.
Mm-hmm.
And they're telling me not to go around my family. I'm confined to my room when my daughters have to bring in my food, and I make sure they have on masks and gloves to make sure that they're safe while I'm suffering.
Lots to think about there. We want to thank Joyce for taking the time to talk to us about her experience. We're going to take a short break now, and when we come back, we'll talk to two people who are on the front lines in the battle against the coronavirus. I'm Mike Gilliam, and this is Let It Rip.
You're watching CUNY TV, the City University of New York.
Welcome back. Now, we've heard from a patient. Now let's move on to those on the front lines in the battle against coronavirus in New York. Joining us is the district manager for District 57 in Brooklyn, Olanike Alabi, and Dr. Ramon Gist, the director of pediatric critical care and a member of the emergency prep division at SUNY Downstate Medical Center. Welcome to both of you.
Thank you.
Pleasure. Thank you.
Okay, doctor, is this poised to crush the healthcare system in our country?
There is a significant risk for that happening. If you look at the four tenets of preparedness, we look at staff, stuff or supplies, systems, and space. And all of these parts of our system are being stressed right now. So the risk is quite high.
Olanike, what are you seeing out in the community at this point? Are people getting it? Are they taking this seriously?
I think now that we know people in Brooklyn and the New York City area, across the United States, who are catching the disease, I think people are taking it a lot more seriously. But equally important, it's not the symptoms. I think the fact that people are dying and the fact that it's clearly not something that strictly affects, I think that a lot of folks thought that it just affected folks in one group or people who were high risk. I think now that you're seeing folks in their 20s or 30s, I know that people say there are underlying conditions, but it's impacting all of us. And I think people are really taking it seriously.
Yeah, I felt that too. You know, there was a period of time there where I would talk to friends who were younger and they were kind of very dismissive of this whole thing. They would say things like,
if I get corona, I get corona. At the end of the day, I'm not going to let it stop me from partying. You know, we've been waiting for Miami spring break for a while. But the bars and restaurants are closed, but we'll find ways out forward.
You know, but I think that as this touches more of us, more personally, it comes home. I know that we've had a family member who passed away. She was older, but she did pass away from this disease just in the last few days out in Seattle. So it's a very real thing that's coming home, I think, to all of us, and it could very easily touch us all. What do you think, doctor?
It seems that people are getting it, but it's hard for people to understand what they can't see. And they can't see what's going on in the hospitals. They can't see the fact that we're repurposing staff members. Like for myself as a pediatrician, I'm now being tasked to take care of patients up to 30 years old, 35 years old. Typically, we take care of children in the ICU of up to 18 and 21 years of age. So everyone is being forced, because of the situation at hand, to go above and beyond their traditional training. You know, people are coming out of retirement to come back into activation for caring for patients who are coming in. So, but folks can't really see that when they're on the outside.
Yeah, like I've actually heard of surgeons who are now taking training to become more of a ICU critical care nurse, just to try to help out, because that's where the need is.
Right. And the areas of the hospital that have lower volumes, like our clinics, some of the clinics are closed. We're canceling many elective procedures. So those nurses and doctors and aides are all being repurposed to the ICUs and the regular floors and the tents and the ER just to help manage the surge of patients coming in.
Doctor, what more needs to be done? And really, is washing your hands and safe distancing gonna be enough here?
Right now, social distancing is the best we have because there is no immunity in the community. And the problem with this illness, as opposed to flu, is that this is affecting us all at the same time, whereas influenza is spread out over a season. So because it's affecting us at the same time, it's putting a huge burden and really exhausting our supplies and our space.
Mm-hmm. Olanike, the social distancing component of this, are people adhering to it?
I would say yes, most especially as they see the numbers rise in terms of the cases and the deaths. I think it's obviously difficult for a lot of folks. Some have obviously voluntarily accepted social distancing, but obviously, there are others who, because we've closed restaurants, or rather New York State put out a mandate in terms of what gatherings should and should not look like. In fact, today, approximately 80 basketball courts have been cited to remove the hoops so that folks really take this seriously. I think there's a population that obviously does take it seriously based on the information and based on the fact that it's touched home in terms of their friends and their relatives. I do, however, still think that there is a small group of individuals who are still very dismissive, still very away, and we've sort of had to enforce rules and regulations so that folks get it. And that's reason to be concerned. And I think that, to answer your question, there are a lot of folks who are taking it seriously, particularly as the information continues to generate. But I think there are less people who are not taking it seriously.
Dr. Gist, words of wisdom.
Words of wisdom: wash your hands, stay apart from others. Let's continue to engage in social distancing. I also advise, for those of you all who are having the fever and the cough and the shortness of breath, don't wait too long to come to the emergency department, because once the symptoms go to a certain degree, it may be hard or harder for the teams to provide the most optimal care. Early is better, especially when you're having difficulty breathing. And one thing I'll say is that many hospitals now have altered their visitation policies to prevent the spread of disease to come into the hospital. And that's probably one of the hardest parts for families right now, is that they can't be with their loved ones in the most trying times. And so we're all gonna have to go through this together and try to obey the mandates handed out by the governor.
That's a good look at what's happening on the ground here. Now, we're going to take a short break. When we come back, we'll talk about the economic impact and also the ugliness that's been unleashed on the Asian American community in the wake of the coronavirus. We're going to have State Senator John Liu with us. I'm Mike Gilliam. This is Let It Rip.
You're watching CUNY TV, the City University of New York.
Welcome back to Let It Rip. I'm Mike Gilliam. We're locked in a life and death struggle with the coronavirus, and it has brought out the best and the worst in people. With me now to discuss the impact the virus is having on us and our communities is New York State Senator John Liu, who was both the first Asian American New York City Council member and the first Asian American New York City Comptroller. Senator Liu, welcome. Yeah. Well, before we touch on economic impact, let's talk a little bit about the ugly surrounding the virus. President Trump has taken some heat for repeatedly calling the coronavirus the Chinese virus.
Because it comes from China. Racist. It's not racist at all. No, not at all. It comes from China. That's why. It comes from China. I want to be accurate. Yeah, please, John. Please.
Are you
I have great love for all of the people from our country.
What do you think of that?
Well, you started by saying that that COVID-19 has brought out the best and also the worst in some of us. And once again, this current occupant of the White House demonstrates his true colors, not bringing people together, but dividing them. And as an Asian American, in no worse way than to continuously and repeatedly call the coronavirus, COVID-19, the Chinese virus. It is despicable. It tears people apart, and it actually brings out and condones xenophobia and racism against Asian Americans.
That kind of touches on what I wanted to ask next. What has been the effect on the Asian American community?
Well, look, people are afraid. They don't know what's happening. COVID-19 has been devastating across so many communities. And so I understand that people are afraid. And that fear of the unknown has actually brought out true heroism in so many New Yorkers and people beyond. But unfortunately, we have seen some people who look to find people at fault, to point fingers at people. And there's been this really ignorant and incorrect connection between COVID-19 and Asian Americans. People often talk about how it was first discovered in one of the towns or the cities in China, and therefore somehow it's okay to call it the Chinese virus. It is absolutely not okay. They liken it to the Spanish flu. Well, you know what? That was 200 years ago, and it's been completely debunked that there was any connection between that flu and the Spanish people. So, look, the reality is that Asian American advocates and advocates from all different races, civil rights activists, medical professionals, scientists, the World Health Organization, they have continued to dissuade Trump from using the term Chinese virus. And it's not just Trump, it's also some leaders in Washington, particularly Republican leaders. So
go ahead. Are you getting reports, though, of hate directed at Asians related to the virus because of this?
I mean, I've received many complaints in my office about people faced with bias incidents, anywhere from seemingly benign gestures and comments to outright obnoxious remarks to acts of discrimination and even acts of violence, unfortunately. And there have been too many of these incidents actually documented on social media and in the mainstream news with videos about what unprovoked attacks or incidents where Asian Americans are targeted as being the cause of COVID-19. It's just
what's the worst thing that sticks out in your mind from these reports?
Well, a recent news report talks about how a woman was stabbed because she was Asian American wearing a face mask and being blamed for COVID-19. We have seen videos of people just being randomly knocked to the ground in the street and stomped on because of COVID-19, to less violent but still unacceptable gestures and comments levied at Asian Americans. The point is that number one, this doesn't. There's no connection between being Asian and COVID-19, and number two, this doesn't help us fight. We should all be banding together to get through this crisis. It is a health crisis. It is something that we all have to be mindful of. There are rules out there that the vast majority of people are obeying, and then there are also lots of instances where people are helping each other. But we have a few bad apples out there, and that's why I'm particularly grateful to Attorney General Tish James, who set up a hotline specifically to deal with these kinds of anti-Asian bias incidents.
Okay, great. Everyone is very concerned about the economy now. The feds have been acting. There's the stimulus that's out there now. Is the stimulus enough for us here in New York City?
Oh, it clearly falls short, way short. I mean, this COVID-19 crisis is I believe going to make the financial meltdown 12 years ago in 2008, which led to the Great Recession. This economic crisis is going to make that look like a drop in the bucket, because the amount of unemployment, the cessation of economic activity, the the quarantines and lockdowns that have happened in different places across the country, the economic impact is going to be felt for a very long time. And I'm glad that the federal government has stepped up with a stimulus package, the biggest stimulus package in history, $2 trillion. But unfortunately, it is not coming anywhere near close to helping us enough here in New York City and New York State. As we all know, New York City and New York State, this is where COVID-19 is hurting our entire country more than any other place. About 1/3 of the cases are right here in New York City. It does not make any sense whatsoever that such a small fraction of the $2 trillion package would actually come to New York City and New York State. The current numbers are about $5 billion in total, split between the city and the state, about 4-to-1 state city. But we're looking at state budget deficits, I should say revenue shortfalls because of the reduction in economic activity. Revenue shortfalls anywhere between $9 to $15 billion in the next coming fiscal year, which begins next week. And so this is a shortfall that there's no way we can cut expenditures to get ourselves out of. This is a deficit that there's no way to increase taxes to make up the deficit, or a combination of expenditure reductions or revenue increases. This is
so how do you fix it?
Well, this is a situation where the federal government really does need to understand the disaster that New York is now the epicenter of, the COVID-19 disaster and the ensuing economic disaster.
The bailout, is it more of a corporate bailout than it is for employees? And are they even going to be able to really get companies to retain people, to keep them at work?
That's a really good question. I think that the federal package as it stands does have a lot of shortcomings. It is heavy on bailing out, or at least propping up some key industries that have been major contributors of economic and wealth disparities in this country. And they don't necessarily help the workers enough. $1,200 is only going to go a very short way for most Americans, and certainly New Yorkers. Costs of living are high. Prices are higher than normal, in some cases due to price gouging, and in other cases just due to the fact that there's a lot less supply around. So, we need a package that is going to be geared more towards workers. And in fact, a proper economic stimulus package should seek to increase what they call aggregate demand. And the way to increase aggregate demand is to put the money in the hands of people.
Yeah, does this go far enough as far as reaching like people on Social Security though, and that kind of stuff? People on fixed incomes? Doesn't seem like it.
No, I mean, this is exactly what we're talking about. We need to put money in the hands of people. President Obama, when he first took office, he inherited a mess from President Bush, and had to put together his own economic stimulus package. I think the Trump administration and our leaders in Congress should take some lessons from that particular episode.
Okay, where do you see this going now? Any words of wisdom on how to make it through?
Well, first and foremost, it's important for us to all observe the rules that have been set down: personal hygiene, washing hands thoroughly, and following the minimum 20-second rule, not touching your face or any part thereof, and coming into as little contact with other people, observing social distancing, and continuing to wipe down or disinfect surface areas that are in contact by multiple persons. We also need to be patient about what our emergency services can do. Our hospitals are, in the governor's words, are going to be overwhelmed. It is inevitable. It's only a question of how much we can mitigate the process. And
Elmhurst Hospital.
Yeah, I mean, Elmhurst Hospital, and there's a lot of attention now on Elmhurst Hospital, but this is going to happen with, I think, every other hospital in New York. And the goal is we're not going to be able to avoid that. We can only work towards mitigating some of the overwhelming of the hospitals in our area. And the federal government needs to step up. Governor Cuomo was absolutely right when he castigated Washington for sending 400 masks when we needed, 400 ventilators when we needed 30,000 of them.
Yeah, absolutely. Senator John Liu, thank you very much for coming on. We really
Thank
appreciate
you for
it.
paying attention to this and helping to get the word out. Thank you, Mike.
We've covered a lot of ground here, and I want to thank our guests for talking to us in the midst of the crisis. Joyce Brayboy, who is recovering, we wish her well, and also State Committeewoman Olanike Alabi from District 57, and Dr. Ramon Gist of Downstate Medical Center. Thank you all. We're going to take a short break. When I come back, I'll have my final thoughts. I'm Mike Gilliam, and this is Let It Rip.
You're watching CUNY TV, the City University of New York.
Welcome back to Let It Rip. I'm Mike Gilliam. We've been looking at the various aspects of the coronavirus. I think it's safe to say that while we were warned it was coming, most people couldn't grasp the severity of it. It seemed like it just couldn't happen here. Now, many have died and the economy has suffered. We've seen the good and the bad, from the performances of our elected leaders to our friends and our neighbors. Hopefully by now, everyone is taking the fact that this is here very seriously and working to save lives. I really don't have any heavy bits of wisdom for you at this point, but what I would say, follow what the scientists and doctors recommend and be kind to each other during these tough times and beyond. Stay safe, and I'll see you next time on Let It Rip.